I like it.
I don't know.
That was a good clap.
Welcome back to Health and Hormones with Dr. Allen. We're glad to have you guys today. Today we're going to be talking about
Estrogen.
We got it this time.
Yeah, right.
Synced it up.
That's awesome.
I'm excited about the topic today. What's interesting about estrogen is, and I think I've told you this before, is I used to think estrogen was, anytime I heard it, I was like women, girls, And I've come to find out that that is not the case, and that it's very important in men as well. So
Absolutely.
excited to hear your thoughts on it.
Oh, like you, I grew up thinking estrogen was only for women. It was involved in their cycle, and men don't need it. And all the research is showing that that is not true. That is not the case, and it's just as important for men as it is in women, just not the same levels, obviously, in men and women.
Let's start with what is estrogen. So it's obviously a hormone regulated in the pituitary.
Absolutely.
And what is its main function or functions?
Well, technically, it's regulated. The ovaries produce the estrogen and the progesterone, but the pituitary sends down two hormones that control its release. It starts when a girl goes into her puberty and has her first period. But in men, it also starts when men go into puberty, and it's a sexual hormone. But we're learning so much more. And if you remember, a hormone is just a key that turns on certain cells' functions, right? And so estrogen is one of those really important keys because it has an effect almost everywhere in your body, particularly your brain, your heart, your cholesterol levels, and your bone. I mean, so many other organs. And so it is so important that we make sure we know where that level is.
How do you test for estrogen levels? Because I know there isn't a actual estrogen marker in your blood. So what are you looking for? Great
question. So you're right. Estrogen is like a class name of different types of estrogen. Scratch that. Estrogen is a class of different hormones. There's E1, 2, 3, and 4, right? So one of the most important ones to know the level of is a hormone called estradiol. And its function is so important in your system.
Learn something new every day.
There you go.
Speaking of learning something new, tell me, what does estrogen do in a woman specifically? So what does it do for her to help her be regulated or feel good?
To be regulated, well, estrogen and its counterbalance hormone, progesterone, their main function is to help prepare the ovarian cycle and to get ready to ovulate. And then if a woman gets impregnated, then to have a baby, right? And so, but this whole menstrual cycle is preparing the uterus. So you'll build the endometrial lining, and then there's some hormone surges at midway, and then progesterone. So these two hormones work so well in perfect alignment that when it functions normal, the menstruation is 3 days or less. The problem is, like we had mentioned, there's so many things that are raising our estrogen levels, so that if estrogen goes high, then as progesterone tries to bring it down and counterbalance, it doesn't.
So estrogen will remain high.
It remains high, and then it keeps getting higher and higher and higher, and over time, then progesterone then gives way, and I'm finding patients all the time that have a 0 progesterone level, which is just
and then estrogen levels off the charts.
Off the charts.
Okay. How does a woman with that type of blood work? What are some of her symptoms?
Okay. Well, the most common starts with an irregular menstrual cycle. Well, what does that mean? It could be either really short, or it could be really long, or it could be when they menstruate, how heavy that is. A normal, healthy ovarian cycle again, is 3 days or less. But anytime it's 5 days or it's heavy, we just talked about on our TikTok about clotting. If you're having heavy amounts of clotting, of heavy blood loss, if you're having anemia from this, we know your estrogen is out of control and too high.
What are other symptoms that maybe a woman might be, maybe other signs that their estrogen's too high or their progesterone, that's out of whack?
Well, estrogen too high can cause, in a lot of women, acne. It can cause weight gain. Estrogen too high can cause mood changes. You can feel, most women will say, I'm not as patient as I used to, but they feel anger, very irritated. It can affect their mind. They can cause headaches. It's very common that and low progesterone or estrogen dominance can cause really severe headaches and migraines. And then, obviously, the changes with that, they miss days of work or school. They're literally in so much pain. And then over time, you develop these ovarian cysts that can then have pain and rupture, and it's just this progressive. And this is referring to younger women. A woman in menopause, this is the cause of hot flashes and night sweats. It causes chronic fatigue syndromes. It affects their bones and osteoporosis. It can affect their heart. Estrogen, the reason it's so important for both men and women is estrogen is one of the most natural ways to open the arteries. So it gets our circulation. When we lose our estrogen, it clogs the arteries and we have heart disease or strokes or other diseases like that. The secret is that estrogen isn't the bad guy. Estrogen dominance would be bad, but it's when estrogen is optimized and your other hormones are optimized, then the system runs wonderful, and it's meant to run that way.
What are some of the benefits of regulated estrogen? I know we've talked about improves memory and balance.
One of the large studies, the Nurses Health Initiative showed that the higher the estrogen, the less likely women would have a form of dementia. Well, right there, every girl would want to make sure they have an adequate level, right?
Right.
It's also one of the most easy and simple ways to protect you from osteoporosis, which is when your bones get so brittle, they break, and you didn't even, not a normal fracture, right? Like you could bend or twist and then your bones break. So it's super important. It can help with chronic fatigue. It helps with night sweats, helps your mood, helps you feel stable. There are so many things. It's just kind of an underlying hormone that when you have it and it's appropriate, the system is working and you feel great.
We've also talked a little bit about how estrogen can help prevent breast cancer. Explain a little more on that. That's a big one.
Well, again, the breast tissue is needing both hormones. And so, there are cancers in the breast that are hormone sensitive. And nobody knows what's causing that. But what we're finding is you don't see that unless there's a genetic predisposition. There are certain genes that predispose a woman to breast cancer and men. But in a normal patient without genetic predisposition, when your estrogen and progesterone are in perfect balance, it actually protects your breast from having breast cancer. The two hormones work in unison to protect actually the whole system, right? It makes your period better. It also makes your sense of well-being, how everything's feeling, and so the most important is to make sure it doesn't get out of control or too high, and then also it doesn't get to where you have none, because we need it. It's one of those very important to be regulated correctly. It's also, in America, there's this adage of, hey, if a little bit is good, then a lot must be great.
Right.
That is not the
Not
case.
the case. Okay.
Estrogen, we need it. We don't need too much of it, but we don't want nothing, right? We need it. It's just because you have some doesn't mean you need too much.
Got to be regulated and optimized.
Absolutely. Yeah.
You know, we like to go over some specific patient cases.
Sure.
Do you have any that come to mind? I know I'm putting you on the spot here. But that's why you're
Of
someone,
men or women?
women. Let's do women
okay,
first
okay.
before we go on to men and talking
Sure.
about. But like a good case where a woman's, was showing all the signs and the blood levels were showing low on her estrogen and the treatment and et cetera.
Yeah, no. Just had a patient, early 60s, frustrated with her health, trying to exercise, in shape, trying, but has put on 30 pounds without changing diet, without changing sleep, without changing exercise. She's having hot flashes all the time. It's embarrassing. She says she'll, get dressed
She's
up
already
and go
been
out
through menopause.
Well, that's what
Or-
she was told. Is
Okay.
she's done with menopause, which you're never done with menopause.
Just
right?
say another topic for
yeah,
another
that's
day.
another topic. You don't ever get out of menopause, okay? Because once it starts, you never get back to where you go backwards and have periods again, right? And so, but overall, she just frustrated. Biggest complaint was now she's gaining weight right around here, right around her abdomen. Hasn't slept. Can't stand her husband. She's just absolutely. And so we looked at, did a big blood test, looked at her blood work, and interestingly enough, she had zero estrogen, like absolutely nothing. And so we started her on a very low dose treatment. Her 1 month follow-up, she came back and said, I'm only having 1 or 2 hot flashes a week, which compared to
After a month of treatment.
Just 1 month. And she's like, I'm already starting to sleep. My husband, I don't want to kick him out of my house anymore. And it was just really amazing to watch and then we adjusted her dose because we don't want her to have any hot flashes. And so literally, and one adjustment, now she has none of that. She's losing weight, feeling better, and it's just one of those amazing people or stories to watch where they're at, and in such a short time of replacing this hormone, the absolute wonderful results.
How do you replace that hormone? Are there, assuming we can do pellets and...
Sure. So no, there's different forms of estrogen. Again, depends on what we're treating, right? And so the most easy and the best form is an oral form. There's oral tablets. The oral form has an added protective measure because as it goes through the liver bypass, it can protect your brain, but also protects your heart.
Okay.
It's very heart protective. There are some patients that if there's too much time, some of the studies show concern of that, but still, by far the best form is oral estrogen. You can do a transdermal, which is a cream that you rub on. Works really well for patients that are high risk for having strokes. Sometimes some of the studies show that is better, but lifelong oral is still the best form. Now, because estrogen helps with urogenital health, especially vaginal atrophy, which is where the vagina gets older, there's no hormone stimulating, and it just gets super dry, painful, very painful. There are forms of estrogen that you can, they come in a trochee, which is kind of like a Jolly Rancher-like shape, and they slide it in there, and it slowly releases into the vaginal tissue, and that helps with really severe vaginal dryness. So you don't have to have pain, right? And then the last form is a pellet, and the nice thing is that's the same. It's a transdermal form. It slowly releases, so there's a very even release of it. The other benefit of that is in my patients who are not very compliant,
They don't have to think about it.
they don't have to think about it, and it's done. And so if a patient forgets their meds,
Great option.
it's a great option. Yeah.
Very cool. In men,
Okay.
let's talk about
Awesome.
estrogen in men. Why? Like, what's the importance of estrogen in men? And it sounds like it's developing a lot as of
Sure.
recently.
Well, originally, estrogen got a negative connotation in men because of bodybuilders found that if they kept their estrogen levels high, then they would retain some water. And so if they were trying to get onto a stage and be cut lean and, be stage worthy, that they had to eliminate their estrogen levels. Well, that's where a lot of the research was started, right? Is to show estrogen elimination. But long term of that, they in those bodybuilders who are fit and shape and strong and healthy, they're seeing really severe signs of heart disease, because as you eliminate your estrogen, there's a much higher risk for heart disease. And so, like you'd mentioned, a lot of this newer information that we have show that we do want to have men have some form of estrogen, just not too much.
How do men regulate their estrogen levels? What's the best way for them to do that?
It's a great question. First of all, if men don't have testosterone, then they definitely won't have estrogen.
Okay, so those two are...
So they work together, right? So in men, as you raise a man's testosterone levels, it invariably will raise your estrogen levels, usually appropriately so, right? Now again, because as we've mentioned before with our diet and some of these other things, even men can have higher estrogen levels. And one of the ways for a man to know about his estrogen is how big his belly fat is, right? Visceral fat raises men's estrogen levels. So the more we have visceral fat, the more likely we're going to have elevated estrogen levels in men. So testosterone, which can counterbalance our visceral fat, is one of the most protective ways of saving a guy from getting the dad bod, and protecting him from that.
And so when a man goes on testosterone replacement therapy, a lot of them will talk about they're taking some form of an estrogen blocker, right? Explain to me, I know one of them is called an anastrozole.
Sure.
There's other natural ones, but
Sure.
Explain to me what those do specifically, and are they necessary, and is that just patient specific, or how does that work?
That's a great question. So, again, as you take testosterone in whatever form you're getting, it will invariably raise your estrogen. Well, again, the belief was using an estrogen blocker so that you could be stage worthy and be lean and cutting. Well, the truth is most men aren't trying to do that. They just want to feel better. So do they need to block the estrogen? And the truth is, I would say no. Most of the men can block it naturally. Now, there are some men that will take the testosterone and their estrogen will shoot out of control, like way too high. And the biggest concern that men have is gynecomastia, which is male breast enlargement, or moobs, or whatever you want to call it,
Nice.
right? But the goal is to prevent that, right? And so by giving testosterone, there's vitamins that you can take to lower estrogen. There's really a popular one made out of broccoli. It's very safe, and that's what I recommend, because that can help block some of those, the estrogen dominance enough so you still have the benefits without blocking all the benefits, right? Or having the side effects.
Yeah, because so how would a man say they are beginning to develop the breast tissue or larger than they think they should,
Sure.
or whatever? Is that, obviously you seek your guidance of your physician, but
Obviously, yeah.
yeah. But what are some of the things? It's probably a lot tied to diet as well, right?
Absolutely. Eating foods, cutting back on your sugars. But the truth is, in all the years that I've been doing this, there's maybe been a handful that have actually truly developed male breast enlargement or gynecomastia. And there are some that will have some tenderness, maybe. They'll say, hey, I feel a little tenderness or something sore. The truth is, it's more about the dosing and adjusting their treatment that will help them the most.
And you're proactive in blocking it naturally with
Absolutely.
This broccoli this supplement you talk about, correct?
Yeah. And my experience is when you use some natural supplements with testosterone boosting hormones, it works really well. Most guys have no side effects. They have appropriate estrogen levels because in men and women it protects our brain. We need all the help. It can help prevent dementia. It lowers your cholesterol. So there's so many things we don't want to block that effect.
Right.
And so the goal of hormone optimizing is optimizing every hormone so that we get to our optimal health, right?
We get the good and eliminate the bad.
Exactly. There's some exciting newer research on estrogen, taking estrogen for prostate cancer.
Oh, wow.
And so, we won't go into that today because that's a whole nother podcast, but we're excited to bring that forward too, that estrogen is protective in many different ways.
We hope this has been an informative podcast for everyone. I feel like the estrogen is a powerful hormone that is misunderstood, like a lot of them, but especially estrogen. I mean, to know that it can help heart health and your digestive tract and your reproductive tract. It's like, this is crazy. A lot of great information to help us all make sure that we're getting them dialed in.
This is kind of a general overview.
Surface.
Very surface. We'll want to break down different treatments of estrogen down the road, and the history of estrogen, I think, would be a great thing to see. That it used to be the standard of care many, many years ago in the 60s and 70s. Every woman, without thought, was put on estrogen. And then a drug was made that did wonderful things. And that medicine helped a lot of people, but then there were some side effects. And so then we got into some of the hormones, and the scare of estrogen was that estrogen's linked to cancer. And that's where everybody just stopped.
Okay.
They stopped, and so we'll break that down on another podcast. Stay with us. We'll get some good podcasts for you. But estrogen has gotten so... people are so afraid of it. They're so scared that they've actually retracted. Now we're seeing way worse medical conditions because of the lack of estrogen. And so we want today just to give an overview that everybody needs it. You need the right amount of it. It's easy to replace, and there's different supplements. And like we mentioned, broccoli is your best friend if you want a good level. And but there's great ways to keep it optimized without causing any of those side effects.
Amazing. And if you guys have more questions about estrogen or anything, please put in the comments below. We look at those. I'm in constant contact with Dr. Allen. So when we're responding to those, that's Dr. Allen giving you the feedback, and we hope that we can answer those as soon as possible.
Yeah, ask your questions, because we can't give new content unless we have more questions. So please let us know what you're thinking or what your concerns are.
Thanks for joining us today on Health and Hormones with Dr. Allen. We hope you got benefit from this, and we look forward to seeing you next week, where we are going to discuss, tell them, this is big.
Abnormal periods.
This is going to be...
abnormal periods.
We got them.
It's gonna go crazy.
We got them.
All right.
I won't be here for that. No, I'm just joking. No, we hope to have a new guest on that will be able to actually have some real life experience with periods. So
there you go.
Look forward to it.